I think the question becomes now, and when we institute this regimen of carboplatin, pemetrexed, and pembrolizumab, and in the study, KEYNOTE-189, they were allowed to go on to maintenance pemetrexed, pembrolizumab. And the question really is, if we're instituting these three drugs, what do we do next when patients either can't tolerate the regimen or when there are side effects or progression? And this is really an area that we're still trying to learn because the data has been has come out so rapidly and unexpectedly, showing the survival advantage, that I think we're trying to learn what to do next. And in my mind, what to do next is often a clinical trial. That's important. We need answers here in this setting for patients because they've already gotten immunotherapy up front. And in the maintenance strategy, that immunotherapy is probably not the best, or a different immunotherapy is probably not best next. I think one of the drugs that could be considered, obviously, is docetaxel. It's been a tried and true drug, but I think if you're going to consider using docetaxel for a patient who has either progressed on triplet therapy or can't tolerate it, you should also consider adding ramucirumab. Ramucirumab has a place in relapsed-refractory non-small cell lung cancer. This, of course, is evidenced by the REVEL trial. This was a trial that looked at a large number of patients who had both adeno and squamous cell who had progressed on platinum chemotherapy. Some of these patients also had bevacizumab in the platinum regimen and were randomized to either docetaxel versus docetaxel plus ramucirumab. And the bottom line in a very clean study was that the addition of ramucirumab in this patient population improved response rate, improved progression-free survival, and improved overall survival. And I think this regimen is becoming more important as we think about new frontline regimens, as the changes that we will see in frontline regimens with the triplet therapy of carboplatin, pemetrexed, and pembrolizumab, I think highlight and underscore the importance of this combo as a second-line combination strategy. So the addition of ramucirumab did not increase toxicities that much. I mean, certainly there were some increased toxicities, but it certainly wasn't prohibitive with this regimen. So I think the REVEL trial was also practice-changing. It offers another opportunity to deliver anti-angiogenic drugs in combination with docetaxel for these patients that progress on a platinum regimen.